Good afternoon, everyone. So today's topic is vernal keratoconjunctivitis. Other name for this is spring catarrh. It's a chronic, non-contagious eye allergy disorder, and usually it is a seasonal, and it is most common in children and young adults. Here, because it's an allergy condition, the IgE level is always increased in serum and in the tear secretion. And mast cells and eosinophils are also there in the conjunctival epithelium. So in this condition, what are the symptoms? Because it's an allergic condition, always in allergy, there is itching. So here, lots of itching is there. And after that, there's a watering. The discharge is supposed to be a ropey discharge. It's like a thread type of, because lots of mucin is there. Because of that, you will see that the patient will tell you that when I take out the discharge, it is like a thread. Because it's lots of mucus is there. And redness is there. And sometimes if it is very severe, the patient may complain of foreign body sensation. If the cornea is involved, there may be photophobia, blepharospasm. So these are the quite common symptoms in case of spring catarrh. When you talk about this vernal keratoconjunctivitis, usually the conjunctival epithelium is involved. So wherever there is a conjunctiva, there is a signs. If you see in the limbal area also there is a conjunctiva at a corneoscleral junction, that's a limbus. You will see elevated things, small, fine, elevated. They are known as papillae. This is our conjunctival structure, which is having little edematous is there, localized, small, fine edematous structures. So these are the papillae. Here you can see the papillae. And this is a everted type of lid. You can see here also palpebral conjunctiva where there are papillae. So these signs are there in case of so in case of allopathy, we start with the anti-allergic eye drops. And if it is very severe, then cold compression is there. And many other drops are there, like cyclosporine, if it is very chronic and all. So this we can give in allopathy. Of course, we have to do slit lamp examination. And of course, the steroids, which we have to give because allergy conditions, the steroids are the only thing. And with local steroid, there are lots of side effects like glaucoma and cataract. Sometimes we might have to give oral steroids. So again, the side effects of oral steroids is there. So these are the things, chronic condition. I think we have to think of other pathies also and start with other treatment. According to me, we have seen many patients of spring catarrh where we have treated with homeopathy also.
All right, so I hope you can hear me, and I hope that you can see me. So Dr. Pushpa has already spoken about the entire pathophysiology and the take with modern medicine about spring catarrh and conjunctivitis. And definitely, most of you who are watching already know that homeopathy has a very good kind of scope in treating such cases. And we all know the common medicines, that Allium cepa, Euphrasia, Pulsatilla, Nux vomica, Cineraria. These are very well-known remedies that sometimes people who are not even homeopaths use for catarrh. But I'm here to talk to you about 2 or 3 very interesting things. The number one thing is that in many cases, patients come to us because they have already tried everything. They have tried steroids, they have tried antibiotics, and then they come to see a homeopathic doctor. So we have certain homeopathic medicines which are called as sarcodes, which are basically remedies which can reduce the side effects of steroids. So we have certain homeopathic medicines like cortisone 30, histaminum. These are sarcodes when indicated we can really help reduce the side effects of steroids, antibiotics, immunosuppressants on the body to an extent. And the other thing I want to tell you is that when these all common homeopathic medicines, which we just sometimes some of us prescribes just randomly fails, this is where we have to go at a deeper level. And sometimes you have to understand the miasmatic patterns. So depending on the type of case, understanding the miasmatic patterns, whether there is a psoric miasm at a deeper level, psychotic miasm, which is very common at a deeper level, in some cases, a syphilitic miasm at a deeper level, tubercular miasm at a deeper level, understanding the entire history's miasmatic traits. If we are able to understand these miasmatic patterns, the core dominant miasm, we are able to choose a very good remedy that can actually focus at the deeper core level block that can help in the healing pattern. So, especially in ophthalmic cases. And we have some very interesting cases, for example, of medorinum, of mercury, of thuya, prescribed at a miasmatic kind of prescription. So, this is something which is a very skilled homeopathic clinician can prescribe. So I hope that you all take the benefits of homeopathy and modern medicine and kind of change in lifestyle together. And that's what I pray for you, the best health and peace. So if you wish to take a consultation, find a good homeopath in your city and meet him or her. Or if you wish to consult us in person or online, we are based in Mumbai. You can write to us. You have our email ID, gaurangedgy@gmail.com, and we are glad to be of help to you. You can see it on the screen. Thank you and namaste.